time to live and be yourself tonight. You gotta feel it, you just have one life. It's time to live and dance into the light. Your life is beautiful, you just have one life. It's time to live and free yourself tonight. You gotta feel it, you just have one life. It's time to live and dance into the light. Your life is beautiful, 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 life is beautiful.
All right, welcome back. I'm Monica Brant. You are tuned into the Monica Brant Show. I got my beautiful co-host, Sarah Gueli, and we have been learning all about our beautiful cover model for Bodyscape magazine and Dr. Sarah Gueli.
Doc is in the house.
Doc is in the house. She's ready to take care of all of us from a distance, even if we needed her to. So, Doc, you what?
Telehealth.
Telemedicine, telehealth. So, Doc, we were talking about your history growing up, and I know that we've just started to dive into some big changes that you experienced after your medical practice, and you were getting started with that. And so, please share from that point forward, because I know it's a big part of your story.
Yeah, so I was in my fellowship. So I had just finished my anesthesia residency, and I had decided to do another year of training to subspecialize in pediatrics. And the fellowships always start in July. So this was maybe like, I think it was just the end of July, August. Well, yeah, I think so. Right around then. Anyways, that doesn't matter. I was at work, and I remember, interestingly, the exact room I was in. It was a neuro room. We were doing like a shunt on a little baby, something like that. And I started having trouble with my right hand. I couldn't pop lids off of the medication vials. At one point, I put my hand in my pocket, and I couldn't even tell what I was touching. But like I'm very non-alarmist. So I was like, maybe I pulled something, like maybe I slept on my hand wrong. But it just wasn't getting any better. So I was going to go tell the nurse in the room to call in my attending so that I could go to the bathroom and just like put some water on my face, get something to eat, get something to drink. Again, like I didn't think anything serious was going on. And I went to go walk across the room, and I couldn't like figure out how to move my right leg. Like it just, I couldn't take a step. It was nothing that I'd ever had to think about before. And all of a sudden, like I couldn't walk across the OR. I didn't know how to do that. And so I just stood there in the middle of the room, and I said, this is the craziest thing I have ever said in my entire life, but I don't think I can move the right side of my body. And like, it was chaos after that for me. Like, I was at a children's hospital, so they took me in an ambulance to like our vascular center that deals with strokes and heart attacks and that kind of stuff. And everything was so surreal. Like I remember being in the ambulance, and they were trying to start an IV, and me trying to help because like that's what I do, but I couldn't move my right hand. And I just remember being like, I just tried to help you start the IV, and I can't move my hand. Like it was just so weird, so scary. And when I got to the ER, the first thing they did was do a quick CT scan, because everyone's thought when you have like paralysis on one side of your body is that you are having a stroke. And if you do a quick CT scan, that's the quickest way to look for a bleed in the brain that could be causing a stroke. So that's the first thing you want to rule out. So you go for a CT scan first. While I was in the CT scanner, I started to notice that the right side of my face was numb too. And if you're having a stroke and one side of your body is numb, it should be the opposite side of your face. It's just the way human beings are built. So for me to be having this numbness on the right side of my face, I was like, I don't think I'm having a stroke. I don't know what's going on, but I don't think I'm having a stroke. And the CT scan didn't show any bleeding. So I had an MRI scan, and they were like, there's something in there, but it doesn't look like a stroke. And I was kind of like, yeah, that kind of makes sense, because I'm kind of having more symptoms that shouldn't be a stroke. So I was admitted to the hospital, and I had like every test you could have for everything you could imagine, like every kind of infection that you're looking for, because I'm in medicine. I interact with people who have weird infections. So we have to test you for every kind of weird infection, every kind of clotting disorder to see if these were little strokes, whatever was going on, everything, looking at my heart to see like if something was going on in there, including like an echo where they do ultrasound of your heart, a transesophageal echo where they look at your heart from inside your throat. And I also had a lumbar puncture, which is where they look at, or a spinal tap, you call it. They look at the fluid that surrounds your brain and spinal cord. And that came back positive for findings that you find in multiple sclerosis. And so based on what had happened, my MRI lined up with it, my age, where I live, and those findings, I was diagnosed with multiple sclerosis.
Okay. How does where you live, how is that affected? And I want to ask you too, because I have never heard this, and it's probably good information. You said when someone's having a stroke, they would be numb on one side, but their face would be out the opposite, or not numb, but paralyzed, but the face would be opposite?
Mm-hmm. Yeah. Well, that's the most common kind of stroke that's going to knock out the one side of your body. So like when they tell you, if you think somebody's having a stroke, can you smile at me? Can you raise your hands? And when they try and smile, one side of their face is drooping. And when they try to raise their hands, they can't. So yeah, so if you're having a stroke that knocks out the whole right side of your body, it would be the left side of the face that's numb. But obviously, if you are having something that knocks out one side of your body, even if your right side of the face is numb, still go to the hospital.
Right.
Just so you know.
Not to get off topic, just quick question. I've never asked this before. Can you have a stroke and have either side of your body paralyzed, or is it always going to be the right side?
No, any side, either side. And you can have any kind of, it doesn't have to be your whole like right side. You could have like just trouble with your right hand, just trouble with your right finger, just, pain, like numbness in your leg, anything, any kind of weird symptoms.
Okay. So back to, you're saying that the location you were in, like, how is that affected?
So there's this kind of theory with MS, because we don't know what causes all these autoimmune diseases like MS, like lupus, like rheumatoid arthritis. And with MS, there's this thought that it could be related to vitamin D levels. And in, normal humans, the amount of vitamin D we get is really influenced by how much sunlight you get. Mm-hmm. So there's less MS around the equator, there's less MS in sunny places, and there's more MS the further away you get from the equator. And like places like Canada have a lot, and like, Buffalo, New York is like a little hotspot of multiple sclerosis because of, who knows, but that one theory says because of sun exposure and vitamin D.
Well, yeah, maybe people are more covered up there, a colder year-round climate.
I think we saw the sun like once in my life, like in Buffalo. I'm sorry, I love Buffalo so much, but it is very cloudy in the Northeast in general.
Okay, just we're learning things along the way here too, and of course hearing your story. Okay, so you are in an ambulance, and I want to just kind of go back to that place there. What's going through your mind? I mean, are you just trying to analyze yourself, or is there fear? Is there like, how do I get hold of? I need to get hold of Jared. Like,
I don't remember being as much afraid as being incredibly confused. Like, it was more like, what is happening right now? And I kept in my head thinking, like, am I making this up? Because I was like, this can't be real. Like, move your right hand. And like, I kept trying to do it. And it was like, I had to keep proving to myself that this was real, because I was like, this isn't really happening to me right now. Like, this is something else. I'm making this up. It's not real. Like,
did you know anyone that was in the ambulance with you?
No.
Okay.
I did end up knowing people in the ER.
Okay.
But I didn't know the ambulance people, no.
And how long were you in the hospital with all that testing going on?
It was like 3 or 4 days. And that was, oh boy, that was so weird. That was the first time I was ever like in the hospital for a long period of time. And it was so weird to be like doing residency at the same time. And like, being like, it was just like yesterday that I was on the other side of this bed and I was the doctor and now I'm laying in this bed. It was without a doubt the like so surreal, craziest thing.
Do you ever, and I don't know where your faith is and, you know, how you believe, and we don't need to talk about that, but I wonder if, you know, because I'm a Christian, and I always think that God allows things in our life to strengthen us, so that we walk through things and we become more mature, we become more, or builds our character, and we also become more sensitive to other people as they walk through something. And it just seems to me, and maybe I'm way off, but it seems to me that, you know, God knew what type of person you were going to be and how you were going to utilize this to educate yourself to get through it. I'm like choking up right now thinking about it, because I feel like in your line of work, if you had not experienced something like that, maybe you would not have as much deep empathy, sympathy, and heartfelt for people that you're caring for moving forward. And God knew that you would be strong enough. He knew that you would take this and make it a beautiful thing for yourself, and that you were strong enough to do this, and that you had the right support with Jared. And I just think it's, I mean, as hard as those trials are, it says in James in the Bible that we are to take every trial and tribulation and count it joy. And it's like, that's got to be so hard in a situation like that, where you're like, this is my dream, my desire. I've worked so hard and here I am. But I just have a feeling that when you walk in to see people and you're working with people in that hospital, you've got to have a bigger heart for them and what they're going through, because you've been in a situation that's life or death, and in that bed, and understanding how that feels to have gone through this, the confusion, like you said, the what's going on, like this can't be happening. This is, you know, and that's what happens with people. Like sometimes it's a long, you know, drawn out thing, but most of the time, right, it's like accidents, you know, cancer hit, or just, you know, what this, it's all of a sudden you're in the hospital and you're like, how did this happen? So I just feel like this internal, like, I had to say that because I know that you've worked to get through this, and you're still working through it. And I know there's still a much bigger story here, but I just, you know, my heart goes out to you, because I think that God has allowed you to have this so that you could share your love and compassion for others that are walking through what they're walking through in the hospital. Does that make sense?
Well, I'm not a religious person, so I don't choose to lean on it from that way, but it 100% has made me more cognizant just of the other issues that are going on when somebody is undergoing this diagnosis transition in their life. It is so much bigger than just those words that we say, because I remember so many times just like we do rounds on patients, and it's like, oh, okay, 34-year-old female, sudden onset right-sided paralysis. And it's like, you know, you say that so many times throughout the day, depending on how many patients you have, that these things that are happening to people that are so life-changing become like blasé. It's like, oh, what are you doing today? Oh, we're taking out like a giant colon tumor from a young kid, or, you know, something like these horrible things that we just say all the time, or not even things that are horrible, you know, like, oh, I'm taking care of a guy with high blood pressure, I'm taking care of somebody with diabetes, blah, 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 blah. But the changes that go on in your life when you get a diagnosis of something, and what it really means on a daily basis, the way it changes your life. It's just, you know, I'm definitely more aware of those issues.
That's, I just, you know, I can't imagine having gone through that and what you're walking through, and you know, still being in the hospital setting and being able to help people. I just think it's beautiful. So, you know, congratulations for you, and big heartfelt, you know, virtual hug, because I know you're walking through it every day, trying to figure out how to continue. So with that, how do you, you know, go, you know, from being in the hospital like that, and how many years ago was that to today? What's been the biggest change, and maybe how you live your life, or, you know, eating, exercise, you know, how have you worked through this?
So that was 9 years ago to the Olympics, because it was the Olympics when it happened. And so it should have been the Olympics 8 years, but they were delayed. So this was 9 years. It was a lot. So I had to deal with it mentally. Like that was its own side of things. I had to like allow myself to kind of be okay with this diagnosis, but I also had to like come back from being paralyzed. I was like, this cannot be my life. This can't be what it is. So once I was diagnosed, they were able to start the appropriate treatment, which is IV steroids, to knock down the inflammation that's going on. And they helped tremendously. I could move my arm and I could move my leg, but it was kind of like when you wake up from sleeping on your arm the wrong way. We're like, yeah, you can move it, but not well. Like I couldn't put makeup on. I couldn't feed myself. I couldn't do anything still with this hand. I could just grossly move it. And the same thing with my leg. I could like stand, but I couldn't walk. I couldn't really, stand just on that leg. I had no balance. So I started walking on the treadmill, and like I would just drape myself over the front of the treadmill and put it on as slow as it would go, and like just drag my legs till I could walk better. I was like, this is just what we're gonna do. And I would be in the downstairs of our apartment, and I had like an IV in place to get my IV steroids because my veins were getting so bad that like we would just leave one in place for a few days, and I would like cover it up with a nylon, and I would go down to the basement and just drag myself along on the treadmill for like an hour or so. And I also had to get my hand back. I wanted to be a pediatric anesthesiologist.
Yeah.
You know how hard it is to get a vein on somebody who doesn't have great veins. And can you imagine I had to get IVs and veins on like premature babies who were in the neonatal ICU who have IVs every few days, like for months. These are like the most challenging little patients. So I had to get back to like being able to do this. So I would do crossword puzzles so that I would have to practice writing really small, and I would play Battleship because you have to pick up all of those tags. And like we played so much Battleship, my husband and I, you have no idea. But we would also just like, I would make up games where like he would just put white and red pegs in, and I would just have to take out all the red pegs or put in all the white pegs to like just get back really quick. And he would bring home like IV tubing, and I would just practice like spiking IV bags and setting things up. And I just did this for the entire time that I was awake, like from when I would get up in the morning until when I would go to sleep. All I would do is try to get better, try to walk better, try to write better, try to like brush my hair. Like I didn't want help from anyone. I didn't want anything. I like needed to do this. And I ended up going back to work like after that month. And I was like so proud of myself.
So, okay, wait a second. I have a couple questions. My brain was like, what about? So can you remember the moment where you were you at home? What were you doing when you actually felt like you could move your right hand again? Like, where were you and what was that? I understand that the sensation, but you described that, but where were you and were you like, oh my gosh, I'm able to move my hand? Like,
it was like, I don't remember exactly when it was because it was kind of like this gradual thing where you were like, well, I can move it, but I can't even like feel that I'm moving it, or like, things like that. But it was right around like that first course of really high dose steroids that I was like, oh, look, I can kind of do things again.
So with the MS, you were talking about the inflammation. So once the inflammation was brought down and kept down, is that what's really helping you to keep MS at bay? Or like the reaction, I guess, in your body?
So there's different medications for MS that you can take too. So MS is an autoimmune disease. So basically your own immune system starts attacking the lining of your nerve cells, and wherever it's attacking the lining is wherever your symptoms are. So I'm kind of like weird lucky. I don't have a lot of lesions of MS, but the one spot I have is way deep in the brain in like the motor control center of the right side of my body. So when my MS is active or more active, it's like the whole right side of my body. And
by now you've probably adjusted to knowing kind of, can you feel something maybe coming on and be able to adjust for it if you needed to?
Yeah. And for me, the big one is fatigue, like I'm a very active person. I'm at the gym. I love hiking and biking and like I'm nonstop. And so there's some days I wake up and I'm like, I can't do anything. I just am toast. And that's when I know, okay, I'm like taking a rest day. We're going to relax. We're going to just chill.
So can you prevent things from happening further by taking just a rest day? You just know that that's
well,
what you
for me, I've been very lucky that, yes, I've been able to not have any serious flares when I'm just kind of been monitoring my own body and taking the time. But, you know, not everybody has this kind of course. Some people have a course that has a lot more relapses. Some people's MS is just progressive continuously from the outset. It's a very, there's so many different variations of this disease. So I consider myself pretty lucky.
Have you seen a big change? You just said about being active, and we know that you've got some muscle on you, and you're lifting heavy. You're picking heavy things up and putting them down. And I know that you watch what you eat. Obviously, I mean, you can't look like this or like this without having some kind of gauge. And I know we know you've been on stage. So how much has proper eating and exercise played a part for you with this? And do you think that if other people with MS would, follow, kind of your guidelines, would other people have the same success? Is it something that you could kind of gauge like that?
I don't know, because once again, this is such a varying disease. So I started off on medications after I was diagnosed and I was back at work, and I didn't want to tell anybody at work because I didn't want people to think I needed help. I was so stubborn. I was like, oh, I'm just going to pretend that, like, everybody kind of thought I had a stroke. So that's kind of what I just let them believe, because I was like, oh, that's easier. Better, easier, smoother ended alternative. I had a stroke. I'm better. The end. And I went on medication. The first drug I went on was called Avonex, and it's designed to knock down your immune system. It's called an interferon, so it makes you feel like you have the flu. I had to inject it into myself once a week. So you give yourself the shot, and then the next day you feel like you have the flu all day. But I was like, I'm doing this because I want to take care of this disease. I want to be in control of my health, doing the right thing. And so I did it for, until I think it was like December. It was right around Christmas time, because I had some time off because of the holidays. I wasn't on call. And when I went back to work, my coworkers were like, why are you yellow? And I didn't even notice it because it had happened so gradually, but I was going totally jaundiced. The whites of my eyes were yellow and my skin had this yellow hue to it. So I called my neurologist, and he was like, well, obviously stop taking the drug because there's case reports of side effects of liver failure. They're really very rare. So some people get just elevated numbers, liver numbers, with no symptoms. Some people get a little bit sick, but there's so few reports of these people who get this complete and total liver shutdown. And that's what happened to me. My liver totally failed. My numbers were off the charts. When I tell my coworkers what my numbers were, that's when they're like, oh, yes, you were really, really sick. I was really, really, really sick. My neurologist was like, you need to be in the hospital. And I said, well, I work in a hospital. I was so determined.
I'm there. You're so
wasn't going to take any more time off, because I had taken 4 weeks off with my diagnosis, and we get 4 weeks of vacation. So I didn't want to take any more time off because I wanted to graduate on time. That's what I was focused on, which is crazy to me to think about, because we had conversations that my neurologist was like, if you slip into a coma, what is going to happen to you? This is what my numbers were. I was so sick. And I just didn't care at that point that I was that sick. I was like, I am so determined that this is the life I'm going to have, that I don't care. If I can't have that life, I don't want anything else. And so I just pushed myself. I refused to ask for help. I refused to stop. I really thought that I might die. It was very serious. I would tell my husband, I love you, every night, because I was like, I don't know, what's going to happen. And like, these are my wishes if things don't go the way I want them to. Things were very bad, and I was smart enough to know how serious it was, which was like kind of horrible to have to live with. And it was like 6 weeks that things kept getting worse and worse and worse until they finally hit a plateau. And then a few weeks later, they started to come down and then down and down. And it was like spring into summer of that year that I finally felt like back to myself. But that was just like a major tipping point for me to be like, you know, maybe pushing yourself like this is kind of stupid. Like, and it was that first little warning light in my head that was going off, like, this is not sustainable. This is not sustainable. But I don't know, humans have this wonderful ability to forget things. And so I was able to forget how horrible that was. And I got started on a new medication, and that was going to be better, and things were going to be fine, and I could go back to work. And I ended up graduating, and we took a job downstate in the Hudson Valley, and I worked like a regular, you know, doctor. I worked 80-hour weeks. I worked nights, weekends, holidays, calls. And like, I was just progressively more and more exhausted. And one day I went in for some lab work, and I had like 0 immune cells, like, because one of the side effects of this medication, it's supposed to quiet down your immune system, but this had just like totally shut mine off. So I had to go off that medication. And that's when I was kind of like, I can't keep doing this. Like, this is not worth it. So that was like 5-6 years ago that we started making the transition to move out here to Colorado so I could work less.
Wow.
Sarah. Wow.
So
how long were you hospitalized that last time, that one time? How long were you hospitalized when you realized that your liver was completely?
Oh, I did not go into the hospital. I refused.
Oh.
I stayed at work. Like, they wouldn't really let me see patients because I looked like a monster. I was yellow. I had lost so much weight because I couldn't eat, but I was still like very swollen with fluids. So I would just kind of sit in the OR and just do cases all day. And I would get out of breath walking from my car to the locker room to get changed. And oh, it was just, I was so sick. I couldn't, like I said, every time I would eat, I would get sick to my stomach. And like, when you have bile built up in your skin, if you're jaundiced, it's incredibly itchy. So I was just itchy all the time, like just scratching. Yeah, I couldn't breathe. I had fluid in my lungs. It was just, everything was horrible.
How did your husband deal with you? Like, was he just, was he trying to get you to stop, stay home, relax? No, like, was he just supporting you in whatever decision you wanted?
I think he knew that there was nobody that was going to stop me. So he didn't try to fight with me. He tried to just, you know, help me wherever he could. Like, he was like, oh, do you need a ride here, a ride there? I'll make you breakfast. Let's do this. Let's get you to bed, like that kind of thing. And I think we don't really talk about it that much, because even like when he was reading the magazine, he was like, I don't like to read about this stuff. Like, we just don't really, I don't know. It's like we obviously went through it, but it's not like something we enjoy revisiting.
Yeah. No, sure.
Understandable.
Yeah. Wow. Okay. So what a crazy roller coaster ride, right? Like, from one thing to the next. And so now you're in Colorado, and how are you there? What's happening in Colorado? And it appears from the outside that you're in a better place.
We love Colorado. We love New York. New York is a great place. I will never say anything bad about where I'm from. But we had always, like, my family had always gone out west to go hiking. His family had always gone out west to go skiing. And there was always this kind of thing that we said to each other, was like, well, when we get older, we're going to go live in Colorado. And then with everything that was going on, it was like, well, why do we keep saying when we're older? Like, we're older. Let's go to Colorado. How old do we want to be when we go to Colorado? Right. Like, why can't we go there now? So we've been out here for like 4 years now, and we have so much fun. It's such a good place for us.
That's wonderful. And are there medications you're on now that are working for you? Or
I don't take
off?
medications now because, like, I had this discussion with my neurologist. I was like, look, I was on 2 very different kinds of medications, like Avonex that I was on and 𝗬𝗂𝘂𝗁𝗲 that I was on work in totally different ways to keep MS at bay. And I had 2 totally different side effects. It's not like I had these 2 different drugs and both of them gave me liver issues. So, okay, avoid drugs that give you liver issues. It was like I had liver issues, I had immune system issues, and both of them were crazy things that like don't really normally happen to people. Like the Avonex one is a case report. I could be a case report because it just doesn't happen. It's so rare. And even the 𝗬𝗂𝘂𝗁𝗲 one, it happens, but you know, it's one of those things, you listen to those commercials and they say, oh, you know, a rare condition called PML is, you know, it's rare but possible, check your blood tests and things like that. And the thing with PML, it happens when you get your immune system dropped down to 0 the way I did. It's one of the things, one of the infections you can get. So like I didn't get the PML, but still it's a known side effect, but I mean, side effects shouldn't be the most common thing that you're experiencing with medication. So for me, and the type of MS I had, where my lesion is, the activity in my disease, it just made more sense to not be on medications. Now, there's people who have incredibly active disease, who have lots of relapses, who have primary progressive MS, which doesn't relapse and remit, it just constantly stays. And there are people that medications are certainly 100% the right decision for, but they just were not right for me.
Well, that's pretty amazing that you're off meds and that you're living the lifestyle that you're living. And
yeah, I consider myself very lucky. And I like will nitpick myself. I'm so lucky that like I'll be, you know, I decided I wanted to do this bodybuilding stuff. So I'll be doing like posing and stuff. And I'm like, oh, my right side's not the same as my left side. Like I am so lucky that I get to complain about something so silly. Like, so it's
well,
okay.
let's talk about your competitions and how you know, how did that come about? How many have you done?
Yeah. So I started bodybuilding, kind of seriously shortly after my diagnosis. I ran one more marathon because I kind of had to prove to myself that just because I had this disease, I could still do what I wanted. And it was like overall the most unenjoyable experience of my life. I hated every training run. And like, you know how you can get race pictures? I like never ordered them before, but I ordered 2 of them this time because there's 2 like very special ones. There's one where I am so angry and so miserable that I am just walking and I am like pouting and like the angriest face you've ever seen. And then there's the finish line and like my hands are thrown up in the air and I'm like ruining the photos of everyone crossing the finish line behind me, like blocking out their faces. And I'm like, that right there, look how happy I am, but look how miserable I was. Like, don't ever forget that. You don't have to do that again.
And the fact that you did that, though, to pull that all together after how sick you were is just miraculous.
It was not very fast, but it was.
But still,
important to me, yeah.
But still, do you have those pictures?
Yeah, they're in my garage where our gym is.
You'll need to send them to Claudia. She can post them up for us.
They're pretty funny. I'm clearly ruining everyone's experience behind me.
Wow.
But I had always liked like the weight training side of things. So I kind of just started getting more and more into that. And I had a friend who was big into bodybuilding and followed bodybuilders on Instagram. So I was kind of following her followers. And I kind of started following Nicole Wilkins and using some of her, like she didn't even have training programs out at the time, but people posted their workouts. So I would just kind of make my own workouts out of what she had posted. And I went to like one of her camps and I was like, oh, I kind of really, really like this. And I just started getting more and more into it. And I found that like the lifestyle, it really fits me. I'm like this crazy OCD routine person, and bodybuilding really scratches that itch for me.
That's awesome. I love it. All right. So we're going to take a really quick break here, and we're going to come back to more information and talk about your experience. Your power. 1, 2, 3. Hi everyone, Monica here. Just wanted to thank you so much for watching the Monica Brant Show, and don't forget to subscribe, like, share these videos, and oh yeah, and that little bell notification, don't forget to click that so you'll get more great content every time there's a show uploaded or a video or anything else. So you guys, thank you so much for your support, and as always, stay fit and love life.